Have you ever thought about how amazing our sense of smell is? It's kind of wild when you think about it.
Yeah, for sure.
Well, what if I told you your nose could actually be a secret weapon in the fight against cancer?
Whoa, really?
Seriously. We're diving deep today into an article called Unseen Warnings: 8 Cancer-Related Smells You Shouldn't Ignore.
Okay, so right off the bat, I got to ask. This isn't about freaking people
Like,
out.
no, not at all. This is all about giving you knowledge to help you understand what your body might be trying to tell you.
Gotcha. So it's more about empowerment than anything else.
Exactly. Okay, so first things first. How can cancer actually change how our bodies smell? It's not like a tumor just starts, like, emitting perfume.
Right. Uh-huh. It's a bit more subtle than that. Basically, cancer can kind of mess with your body's normal processes, like way down at the molecular
Yeah.
level. And that can lead to the production of what are called volatile organic compounds.
VOCs, right.
Yep. And these VOCs can be released through your breath, your sweat, even your urine, and they can create some pretty distinct odors.
So it's not the cancer itself we're smelling, but the byproducts of what it's doing to our bodies.
You got it. Think of it like exhaust fumes from a car. The fumes themselves aren't the engine, but they tell you something about what's going on under the hood.
Perfect analogy. Okay, that makes a lot of sense. So the article mentions 8 specific smells linked to different cancers. Is it as simple as if you smell this, you have that?
I wish it were that easy, but it's definitely not that straightforward. These smells can be caused by a bunch of different things, not just cancer.
Okay, so it's not a guarantee.
Right. But if you notice a persistent, unusual smell, especially if it's coupled with other symptoms, it's definitely worth bringing up with your doctor.
So it's like a puzzle, not a smoking gun.
Exactly. You're looking for patterns and connections, not jumping to conclusions.
I like that. Patterns and connections. Okay, let's dive into some of these smells. The first one on the list is a moldy or rotting wood smell, which the article links to mouth or throat cancer. Is that really a thing?
It can be. This smell is often related to secondary infections and something called tissue necrosis. These can sometimes accompany these types of cancers.
Hold on, tissue necrosis. That sounds kind of intense.
Yeah, it's basically the death of body tissue. And when that happens, it can release certain compounds that create that unpleasant, like, rotting smell.
So it's not the cancer itself that smells like rotting wood, but the damage it's causing.
Right. And this smell might be most noticeable on someone's breath. But remember, there are usually other symptoms too, like hoarseness, difficulty swallowing, or sores that just won't heal.
Okay. Speaking of unpleasant smells, the next one on the list is pretty, well, delicate. The article says that a strong odor of decomposition in feces could be a sign of colorectal cancer. I'm guessing that's related to digestion.
You guessed it. Colorectal cancer can mess with the way your body breaks down food.
I see.
This can lead to changes in the bacteria in your gut
Hmm.
and alter gas production, which can result in that stronger, much more unpleasant odor. And of course, you'd also want to keep an eye out for other signs like blood in the stool, abdominal pain, or changes in your bowel habits.
So again, it's about the context, not just the smell itself. This one really surprised me. The article says a sweet but unpleasant smell from the skin or wounds could be linked to breast cancer.
Yeah, that one throws people off. That kind of unusual sweetness can sometimes be attributed to infections or, again, tissue necrosis caused by the tumor.
Ah, okay. I can see how someone might just think it's a hygiene issue and not something more serious.
Exactly. But it's super important to pay attention, especially if you notice it alongside other breast cancer symptoms like lumps, skin changes, or nipple discharge.
Got it. All right, moving on to the stomach. Apparently, a persistent sulfur smell on the breath, think rotten eggs, could be a sign of stomach cancer.
Right. It makes sense when you consider that stomach cancer can also mess with digestion. When your stomach isn't working properly, it can release these sulfur gases, which cause that rotten egg smell on your breath.
So between this and the colorectal cancer smell, it seems like our digestive systems can send out some pretty strong signals when something's wrong.
For sure. And don't forget, stomach cancer can also come with other symptoms, like abdominal pain, feeling full, even when you haven't eaten much, loss of appetite, and nausea.
Okay, now for a really unsettling one. The article mentions a smell of rotting flesh as a potential warning sign of melanoma.
I know that one does sound scary, but it's important to understand what's going on. Melanoma is a type of skin cancer, and as it progresses, it can cause skin cells to break down. And this process can release compounds that create that, well, disturbing, rotting flesh odor.
So if you smell that, does it automatically mean you have melanoma?
Absolutely not. It's not that simple. First of all, melanoma usually has very clear visual signs, like sores that don't heal, changes in moles, and irregular spots on your skin that bleed or grow rapidly.
So the smell is more of a secondary warning, not something you should panic about on its own.
Right. Think of it as another piece of the puzzle, another reason to get checked out if you notice something unusual.
Okay, good to know. All right, next up we have kidney cancer, which the article links to a strong ammonia-like smell in urine.
Makes sense. Our kidneys are responsible for filtering waste products from our blood, right?
Mm-hmm.
And when they're not functioning properly, those waste products can build up.
Ah, so that's where the smell comes from.
Yep. Kidney cancer can disrupt this filtering process, which leads to that ammonia-like smell in urine.
So it's basically our kidneys sending an SOS signal through our pee.
Uh-huh. In a way, yes. And just like with the other cancers we've discussed, there are usually other symptoms too. Blood in the urine, lower back pain, fatigue, and unexplained weight loss.
Okay, we're on a roll here. What about blood cancers, like leukemia and lymphoma? The article mentions a metallic or iron-like odor in breath or sweat. Is that for real?
It's thought to be related to changes in the composition of the blood. These changes are caused by these cancers. But again, it's not the only thing to look out for.
Right.
Blood cancers often come with symptoms like extreme fatigue, persistent fever, recurring infections, and unexplained weight loss.
So if you're constantly exhausted and smell like a rusty nail, it might be time for a doctor's visit.
Uh-huh. Well, it's certainly worth getting checked out, especially if those symptoms persist. Remember, early detection is crucial for successful treatment of any cancer.
Absolutely. Okay, last but not least, we have lung cancer, which the article says might be accompanied by a sweet, fruity odor on the breath. That one seems a little tricky, right?
It is, because that same sweet smell can also be a sign of other conditions like diabetes. So context is key.
I can see how that would be confusing.
Yeah. If that sweet smell is accompanied by a persistent cough, difficulty breathing, chest pain, or hoarseness, it's really important to see your doctor and rule out lung cancer.
Wow, we've covered a lot of ground here. It's kind of amazing to me that our bodies can communicate with us in such subtle ways, even through something like smell. But I have to admit, it's a lot to take in.
It is. But remember, this is about empowering you with information, not overwhelming you.
Right, right.
We'll come back in just a moment to talk more about what you can do if you notice any of these smells and how you can use this information to stay on top of your health.
Okay, so we talked about those 8 smells that could maybe, potentially, be linked to cancer, but I'm guessing it's not quite that simple, right?
Oh, definitely not.
Mm-hmm.
Those smells by themselves, they don't diagnose cancer. Remember, it's all about like patterns and context.
Right, right. It's not a like, oh, I smell that, I have cancer
Yeah,
situation.
no, definitely not.
It's more like a smoke alarm, right? A
Exactly.
signal to investigate, not to freak out and assume the house is on fire.
Exactly. That's a great way to put it. Think of it this way. You wouldn't ignore a cough that just won't quit. Or if you suddenly start losing weight for no reason, would you?
Definitely not.
Well, these weird smells, especially if they're happening at the same time as other symptoms, they deserve the same kind of attention.
So what should someone actually do if they notice one of these smells? I mean, do they just like run to the doctor and say, hey, I think I smell like cancer?
Uh-huh. Well, maybe not those exact words. But yeah, the first step is definitely to talk to your doctor
Makes sense.
and be honest and specific. Tell them exactly what you're experiencing. They can look at your overall health, your medical history, and run any tests they need to figure out what's causing the smell.
It's all about ruling things out and, like we said before, catching anything early on.
Exactly. Early detection is so important for successful treatment.
You know, we talked earlier about how dogs can sniff out cancer, like with crazy accuracy.
It's amazing.
I have to admit, I'm still kind of skeptical. Like, is that really a thing?
Oh, it's totally real.
Yeah.
Their sense of smell is unbelievable.
Like, how much better is it than ours?
It's estimated to be like 10,000 to 100,000 times more sensitive.
Yeah.
They've got millions more of those olfactory receptors, the things that detect smells.
Wow.
So they're literally smelling those VOCs, those cancer byproducts that we just can't even pick up.
So they're smelling the cancer at a molecular level.
Yeah, wow.
That's wild. Are scientists any closer to making those electronic noses that can do the same thing?
They're definitely making progress, yeah.
Cool.
Researchers are working on sensors that can detect the specific patterns of VOCs that are linked to different cancers.
Oh, so it's like a fingerprint for the disease?
Exactly. Each cancer, and even each stage of a cancer, can produce a slightly different mix of VOCs. And these sensors are designed to pick up on those unique patterns.
That's so cool. But I'm guessing it's not as easy as just holding a device up to someone's nose and getting a diagnosis, right?
Right. Not quite that simple yet.
What are some of the challenges?
Well, for one, these sensors need to be super sensitive to pick up those tiny amounts of VOCs.
Makes sense.
But at the same time, they need to be able to filter out all the other smells in the environment.
Hmm.
And we still need more research to make sure these devices are accurate and reliable.
So it sounds like we're still a ways off from having these electronic noses in every doctor's office.
Yeah, I'd say so. But the potential is there.
I can imagine.
Imagine a future where a simple breath test could help diagnose cancer super early without any invasive procedures.
That would be incredible.
Right.
But until then, we got to rely on our own awareness and our doctor's expertise. So, okay, if these electronic noses are still in development and dogs aren't exactly practical for, everyday cancer screening, where does that leave us? Just like sniffing our own armpits and hoping for the best.
Uh-huh. No, not exactly. Remember, those 8 smells we talked about, they're potential warning signs, not a sure thing.
Right, right. And even if you do notice one of those smells, it doesn't automatically mean cancer, right?
Exactly.
All
And the
right.
article we're talking about, it also mentioned that those VOCs, they're not unique to cancer, right?
Right, right. Some of those smells can be caused by other things that are way less serious, like that fruity breath. That could be diabetes, not lung cancer.
Exactly. And a sulfur smell on your breath, that could just be from something you ate or some temporary indigestion.
So it's all the more important to look at the whole picture, not just one isolated thing.
Yes. It's about patterns and context. A single smell on its own, probably not a big deal. But if it sticks around and you've got other weird symptoms happening at the same time, then yeah, definitely talk to your doctor.
So basically, be aware of these smells, but don't obsess over them. Don't freak out, but don't ignore your body's signals either.
Exactly. We're not trying to turn everyone into a hypochondriac, constantly sniffing themselves looking for disease.
But you are trying to empower us with information so we can be, proactive about our health.
Exactly. The more you know about your body and the potential warning signs, the better you can take care of yourself and get help when you need it.
Okay, I'm feeling a little less overwhelmed by all this now. It's definitely fascinating, but I have to admit some of it was kind of freaky at first.
Yeah, I get it, but think about it. Knowledge is power, right? And knowing that our bodies can communicate with us in these subtle ways, that's pretty amazing.
It is. This whole deep dive has been a real eye-opener for me. I never realized how much our sense of smell could tell us about our health.
It's a really fascinating area of research. It shows how interconnected our bodies really are. Everything is linked.
Well, before we wrap up, I have one more question. If dogs can smell cancer, and scientists are working on electronic noses that can do the same, what other hidden signals are our bodies sending that we haven't figured out how to decode yet?
Whoa, that's a great question. And honestly, we're only just starting to understand the human body.
That is a mind-blowing thought. And I guess that's a perfect place to leave our listeners with a little something to think about. We'll be back in just a moment to wrap up this incredible deep dive into the world of cancer-related smells.
Okay, we're back. And I gotta say, this whole idea that we might be able to, smell cancer, it's fascinating, but also kind of creepy.
Yeah, no kidding. Like our bodies are trying to send us secret messages through our noses.
Exactly. So as we wrap up this deep dive, what's the biggest takeaway you want our listeners to remember?
I think the main thing is that our bodies, they're always giving us little hints about our health and these weird smells, especially, if there are other symptoms too. They can be really important early warnings.
So it's all about paying attention to those little whispers from our bodies, not just brushing them off.
Exactly. Trust your gut, literally. If something feels off, go talk to your doctor. Like we keep saying, early detection can make such a difference.
This has been such an informative deep dive. I feel like I've learned so much. Hopefully our listeners have too. It's been great. Remember, the more you know, the better you can take care of yourself.
Absolutely. Do your own research, stay informed, and if you have any concerns, definitely talk to your doctor. Early detection is key. Thanks for joining us on this deep dive into the kind of strange world of cancer-related smells. Who knew
Yeah.
our noses could be such powerful tools?